I'm relying on the presentation of Michael Sparer, who is an attorney as well as has a doctorate and is a professor at Columbia University in New York City. And he gave this presentation to our task force on January 28th of this year. And just as Alex said when he was doing his presentation, we can only in the time allotted just hit a few of the high points here and to try to illustrate what's going on. So I really hope that you might take the time to go to those task force meetings as Alex showed you and actually listen to the testimony or go through the full presentations that were there. So next slide, please. So while Oregon could theoretically implement universal health care without getting these federal waivers, in order to really have an all-encompassing, efficient, cost-effective system, we need to get those federal dollars that are already in the system under our single-payer umbrella. The federal dollars, however, come with a lot of federal rules and regulations. The federal government is the largest single funder of healthcare services when you take into account Medicare, Medicaid, the ACA subsidies, veterans, Indian Health Service, and federal employees. So there's a lot of federal money already in the system that just needs to be taken from one pool of payers to another, to the state. So working these rules is a critical element here. And when Alex has talked a little bit about the waivers that are there, the important thing to keep in mind is those waivers all apply to programmatic experimentation, innovation, not necessarily shifting the money from the federal government to the state of Oregon. So next slide, please. Oregon in running the Medicaid program did get a waiver in section 1115. And we got that waiver so that we could experiment with the coordinated care organizations. And for those of you who might not have heard about those, we have regions in the state for Medicaid recipients that a CCO is kind of the umbrella organization for managing the care of the Medicaid recipients within that region. Some regions have multiple CCOs, but most of them have just one. So the CCO for our region, which consists of Benton, Lynn, and Lincoln counties, is Integrated Health Networks, which is affiliated with Samaritan. And the whole CCO concept is really one that's fairly unique in the country and was implemented to try to have efficient delivery of services and managed care for the people who are receiving the Medicaid. So, excuse me, wouldn't you know, you have to sneeze in the middle of a presentation. So through the section 1115 Medicaid waiver, we did implement, excuse me, again, the CCOs, and it's been successful in the state, according to many people. And it does have that medical home model where you are connected to primary care providers as this focal point of your care provision. So next slide. Under the Affordable Care Act, there's a waiver provision in section 1332. Now this waiver provision was written by Senator Wyden, and he's very proud of the fact that he has gotten this waiver into the Affordable Care Act. But if you remember, we'll go back to the slide that shows the percentages, but the people in Oregon who are enrolled in health insurance through the Affordable Care Act is a very small percentage, 3.5%. So even though it's there, it doesn't have the kind of weight and impact that we need for a single payer system. And it's allows for innovation. It is not specifically saying that money is going to be shifted over to the state. If a state wanted to have, for instance, public option plan, they would have to show that the coverage and benefits would be at least as comprehensive and as affordable as the plans that are currently available in the marketplace. And also that they would cover as many state residents, which I think is a rather subjective, speculative type of criteria. Next slide, please. That these under the waiver provision, they can request payment of what residents would otherwise receive in tax credits. So there'd be a subsidy pass through. But the final criteria is that the program could not increase the federal deficit. So far, no state has applied for or received an ACA waiver. And one of the points that was made by Dr. Sparer in his presentation was that the waivers have all been that have been granted in other areas have been colored by the agenda of the presidential administration in effect at the time that the waivers were requested. So it's very much something that is subject to political agendas. Next slide. Now, Medicare, which in Oregon is a good share of the federal dollars that are being spent, is administered by the federal government. And there are private contractors and managed care plans involved on the Medicare Advantage side of the equation. The state itself plays really almost no role in the implementation of Medicare insurance. There is no clear waiver path to divert the Medicare funding to state single payer programs. The Medicare waivers that do exist, which is under Section 402 of the Medicare Act, encourages innovation, but not the shifting of funding. So next slide. The Section 402 waiver was amended by Section 222 of the Social Security Act. And those waivers can allow for new approaches to reimbursement. So in other words, the way that providers are paid. Any new delivery system models such as PACE, and PACE is the Program for All-Inclusive Care for the Elderly, which encouraged kind of a one place to go to for care for elderly persons with limited income. And then the final thing was additional benefits and coverage. Just like the waivers for the other programs, these waivers are only granted if they would be budget neutral to the federal government. They cannot be mandatory rules or programs unless authorized by Congress, and must be evaluated by independent researchers. So Medicare waivers have not been done. That's the bottom line of it. Now, let's see, I think we want to go back to the slide on the, yeah. So you can see here that the federal waiver programs do not do what we need to have them do. And that is clearly and unequivocally allow states to receive the funding from those programs in order to put together a single payer universal health care plan within the state. and Erisa preemption problems put states who want to try to have a single payer system in the position of having to litigate their way out of the questions, which could be very, very time consuming and expensive. So we need to have a clear route to be able to get the funding shifted from the circle on the left to the circle on the right. So how are we approaching this problem? First of all, I think you've probably all heard about the Ro Khanna bill, House Bill 3775, and the companion in the Senate. I don't think anyone is really anticipating that that's going to make it through the legislative process anytime soon. It's one of those things that we're going to keep trying, but it's probably not going to happen in the next year. The second prong of approach is to use what's called the reconciliation process. And the reconciliation is a special way of getting a bill through Senate. Is the full title is budget reconciliation, and it avoids the requirement in the Senate of having 60 votes in favor of a bill. The key to having a provision in a reconciliation bill is that it has a budgetary impact. And right now, the Democrats are working on a very, very large reconciliation bill that would address the Biden agenda on social issues. Right now, we don't know what's in and what's out, but there have been requests made to Senator Wyden in the form of letters from the task force, from some political leaders in Oregon, and from organizations and Mid-Valley healthcare advocates, as well as ACP, have signed on to this letter asking Senator Wyden to include language in the reconciliation bill that would allow the waivers we need for Erisa, Medicare, Medicaid, and broadening the ACA waiver. Senator Wyden is particularly critical to this process because he is the chair of the Senate Finance Committee. So he's in control of what is going to be in this reconciliation bill process and how it goes through the Senate, which is the critical part of it. So it's it could be a really big step for us to have these waiver provisions included in the reconciliation bill. And that's a hope we'll see kind of evolve within the next month or two when Congress gets back in session and gets to work on it. So now I'd like to turn this over to Mike Huntington, who will show you how you can easily contact Senator Wyden or Representative DeFazio or Senator Merkley with regard to this issue or other issues like lowering the age for Medicare eligibility to 60 or allowing Medicare to negotiate for drug prices that are also important issues at the present time. So,
say, Karen, should we field any questions before Mike does that?
we could do that. If that's fine. And then we'll go to Mike.
Sure. That sounds like a good idea.
Okay. So Alex, if you could stop sharing your screen, then we can see if there are people with any questions. Go to gallery view.
Looks like Mike has a question. Go ahead, Mike.
Just that the 1115 waivers are for the Social Security Act, which was way back, I don't know, 40s, 30s. So that might need to be added to the the slide. The other is that the local CCO group, the definitive name is Intercommunity Health Network, and it's managed by Samaritan.
Thanks, Mike. Any other comments or questions? I know that's kind of esoteric stuff, so, but we thought,
Yeah.
you know, it's
But-
critical. So even though it's kind of tough to wade through, it's an important thing to at least have some understanding of what's involved. Yeah, go ahead, Warren.
I just wanted to say, I thought that was excellent. Thanks for doing that.
Thanks, Warren.
Sure. Thanks,
Except
Warren.
Bobby had her hand up.
Yeah. I thought it was excellent too. I think it is very difficult material. And I was really glad that you had the illustration. The first illustration was really important to show how the 4 or 5 different pies have to go into the single pie on the right. And that helped me a lot. And it helped me a lot when both of you at the end of your presentations, you kind of summarized it. You know, like you said, Karen, to sum up, we're not going to get this without waivers in effect. And it was really important to have that, because if we're going to be writing letters about it, we need to say something like that and not wade into the more difficult material where we could easily put our foot in our mouths. Anyway, thank you.
Okay.
And I think it's real important to recognize that, yeah, we could dance around this. You know, there's some ways that the professors were suggesting we can do it. And, you know, we can also exclude, for instance, the Medicare population and not worry about that and focus on the rest of the people. But to have the best, biggest pool of persons and have the best chance of having, you know, suppressed costs, because we've got the large risk pool. We've got to have.
Yeah, and I should also add to that, if you've watched the video presentation, like the Erisa
No.
presentation.
Notes played together.
Hello? Yeah, if you watch the Erisa presentation, someone from the task force asked of them, well, you know, would this, what's the best chance of something surviving an Erisa challenge? And the professor said, look, you're going to get challenged no matter what you do. So they said, basically, you might as well go big, you know, like just go big and then deal with it, you know, which I thought was a great thing to say. It was like, because you can always nibble around the edges, but you're going to get challenged no matter what you do. So just go big and go for single payer. Michael, yes.
Oh, I'm wondering if Erisa had anything to do with shooting down the Vermont approach a number of years ago, where they tried to get a single payer thing going.
My understanding was the governor vetoed it because they did not consider sufficiently the cost to the state. Now, Mike Huntington might have a better sense of the history on that than I do.
Yeah, I think it wasn't so much Erisa as the understatement that there was going to be an 11% tax, I think, income or payroll, I forget which, to support this. But what they didn't emphasize enough is that if you look at what people are paying out of pocket and premiums, so forth, they were already paying a 14% equivalent. And so that was a problem in communication. And then, of course, opposition from the only big company and insurance company, which I think was Blue Cross in Vermont.
Thank you.
I see Warren's got his hand up.
I would just add that the single payer bill in Vermont was passed without any funding whatsoever. And they were dependent on the governor or the legislature to come up with the funding, and none was ever enacted. There was no funding in the bill whatsoever.
And I think that's one of the problems that prompted our Senate Bill 770 to require that of the task force. So Thank you all for your comments that are in the chat. I don't see any questions listed there. Are there any other?
Any last questions for these guys?
Great. Okay, Mike, you ready there?
Yeah, I'll share screen. So if you type in Mid-Valley Healthcare Advocates or just mbhca.org up here in the URL, so it will look something like this. You won't see this column over here, but we are just featuring our US representatives and senators for messages which are differing from one another, basically thanking Senator Merkley for actively supporting Medicare for all legislation. And the same for Representative DeFazio. But Senator Wyden has been at arm's length, and unfortunately, he is in the sort of the gatekeeper for the kind of waivers and legislation that Alex and Karen just talked about. So we really want to make him understand what his constituents want. And so we would ask you to go here and click on this sign. It says here. And it will take you to this page, which gives you a sort of a review of what Karen and Alex said, the reasoning behind talking with him, and then a sample letter, which I will be editing tonight to add some things. These are talking about the waivers and wanting him to make sure those waivers get through one way or another, whether it's a bill or through the distinct bill or through the reconciliation bill. But I'm going to add the two that he's more likely to go along with, or at least Congress is more likely, is to reduce the Medicare age to 60 and to allow out-of-pocket caps for Medicare. Those would be major cost savers for people on Medicare. The others that are more likely already in the reconciliation bill, and President Biden has included in his proposal, is coverage of hearing, dental, and vision. So that doesn't need extra urging from us, but certainly the waivers, getting the waivers passed, lowering the Medicare age to 60, and creating an out-of-pocket cap, which I'll add to this, would be possible to get through, and that's why we're bugging him about it.